I am accompanied on the podium by the bosses, plural, a trio of bosses who are going to reflect back to us in a very short number of minutes the extraordinarily interesting discussions that we had in the workshops preceding lunch. I don't know if the slides have been put into any particular order. Ursula, do we go in any particular order? Can I victimize my own choice? I can choose, in which case Elsa is selected for the first report. So Elsa, who would be with my, wherever you like. Yeah, more comfortable? Very good. There we are. Fantastic. So Elsa is going to report on the partner organizations' access to healthcare.
Right.
Comfy.
Yeah, thank you. Always this issue with my height. Well, good afternoon. It's my pleasure to report back from the workshop 1, Access to Healthcare. This workshop was held with the partner organization from Health First Europe, and it was moderated by myself and Melina Rasso, who I thank. It was proposed to the participants of the workshop to read the EULAR position paper on access to healthcare for people with rheumatic and musculoskeletal diseases, RMDs, which was developed by EULAR back in 2014. And we invite the participants to reflect upon the main barriers, the main access barriers for people with RMDs and other chronic conditions that were then stated on this position paper. And the first one was on health systems coverage and management. And the second one on performance and organization of healthcare services. And interaction between patients and health professionals, health systems and treatments. And last but not least, access to medicine and treatment. And what we did, we had an interesting discussion, and we certainly will need more time to come up with better conclusions or solutions. But what we came up with was these top 3, and it was very difficult to choose top 3, but these were the top 3 challenges chosen to be addressed. First of all, better education and training at all levels. And when we are talking about education, we are also addressing the general public to be more aware of the symptoms and how to prevent RMDs. We are talking about health professionals and different levels of trainings. We are also talking about the need to educate and train patients or people with RMDs for self-management. So this should be one of the main challenges to address. And the other one was about integrated care and digitalization. These two may seem disconnected, but digitalization should be beside a tool that we can use, also a way to support the integration of care when thinking about care for RMDs. Okay, nice. Not sure if it's better, but... Okay, and the third one is to measure impact and outcomes relevant for patients. And we underline relevant for patients to meet the expectations and unmet needs. So then we discussed very briefly what could be the solutions for these 3 challenges. For better education and training at all levels, we recommend that it's needed to provide education on RMDs at different levels, raising awareness and enhancing training. For the challenge integrated care and digitalization, to provide timely, consistent, patient-centered care in multidisciplinary team with a clear roadmap. And for the challenge of measuring impact and outcomes relevant for patients, we recommend to capture patient-relevant outcomes, including through registries and harmonized database on EU level for better policies. So this was the conclusions from our workshop. We wish we had more time, and I believe if it wasn't for lunch, we will still be there discussing. It was a very interesting workshop, and I thank to all the participants.
Thank you. What I would propose we do is go through the 3 reports, and there will be a roundtable discussion where we will bring a lot of these issues back. But as a memoir, Elsa has proposed that the patient working group does not have lunch next year and will just continue to work. So now perhaps I could ask Tanya to report on her workshop, please. Thank you very much, Elsa. Wonderful.
So, thank you, Ian, for the kind introduction and for not picking us first. I think we probably all enjoyed lunch, so don't make any false conclusion that we will not have lunch next year. We had a very good workshop, and I would like to say that some of the people were not very happy in the beginning, but we made them happy, and everyone was happy in the end. So our topic was managing chronic diseases in the life course, and I was able to co-chair this together with Professor Hans Beilsma, our dear past president of EULAR. And we discussed life course and several different phases of life, and thought that chronic diseases, and especially rheumatic and musculoskeletal diseases, are really relevant in all those phases, and the transition areas are probably the critical phases where we need to look most into. And we came up with 3 challenges, which are actually a little bit similar to workshop 1. So in either of the workshop you participated, you probably see a similar conclusion here, which actually the first one is the lack of health literacy and patient centricity. And we thought that this would probably be linked together. The second one is the lack of an EU-wide overarching strategy and a plan, so to say. And the third one we thought, and we have summarized that in terms of lifestyle, was nutrition, physical activity, not smoking, and all these kind of issues, which we actually summarized under lifestyle. And as you see, those are probably very different areas. We all know that behavioral changes is quite difficult to achieve. Even though lots of doctors know that smoking is not very healthy, they still smoke. So that's probably one example where we see that even it's not only our patient but ourselves where these strategies don't work well that we have now. What are the solutions now? And the idea was to address the challenge 1, that in terms of health literacy being really addressed from the cradle to the grave. So it's really important to already start in children in terms of health literacy. And the idea was that the patient would become his or her own manager of health care, and everything would be focused around the patient. The challenge 2, the lack of the overall plan, the recommendation would be to have an overarching care plan, including multi-morbidities, of course, so not having everything in silos and separately, but have something overarching to follow. And for the lifestyle issue, we thought that awareness and education, and especially employing also digital technology in all the phases of life, might be a very important thing to consider. And especially digital technology would probably help us regarding lifestyle, and maybe not only us, but even more the digital native generations that are coming after us. And we also had some key lessons that we learned during the workshop, and that was that the life path is not always linear, and that we probably need to address gender diversity within the life course. Another key issue was that we probably need further innovations in drug research because people over the life course would take a number of drugs, and we probably need more research into that area. And we also thought that value-based healthcare covering rheumatic and musculoskeletal diseases is actually also an important issue, and maybe one of the new buzzwords that needs to be in, but still it focuses very much on patient satisfaction, bundled payments, and paying for the value that we generate with our treatment for patients. So as I said, everyone was happy in the end, and I said to we said if the participants are not happy now, they should say something afterwards. What we learned from Ian, that there will be no discussions now, but after the last presentation. So thank you very much. I think we really had a very good discussion.
Thank you very much, Tanya. I have to say, when Tanya tells me that I agree with her, I usually just agree. It's much safer. Thank you. That sounds like a fascinating... I have to say, I crept into the back of different workshops, and that was a very vigorous discussion and really very, very important. So thank you for those conclusions. And finally, Loretta, thank you for telling us how you got on.
Yes, so our workshop was on how to coordinate health and social affairs policies, which is actually the backbone of this event today, because it's like we've been discussing already how all these policies are separated at some point. So I had the privilege to coordinate this workshop with Fiona Godfrey from the European Public Health Alliance. And we had lots of happy people. You will see here that we had some overlapping with the other ones. One of the most important challenges were the budgets. The budgets are in silos. So we have a budget for health, we have a budget for social affairs, and how do we actually mix those two budgets? The other one was on coordination. Okay, coordination of care, we are saying. So what does coordination include? The challenge is to have the care not only at the health place, but also at the workplace, and also in different levels of health. So say the multidisciplinary teams, but also not only in here, but at other levels. So we found that part of this challenge of the coordination will be to manage information and communication. So it's communication, coordination, and information all together in the same challenge. Of course, this information also includes training. It's education and training of all the professionals and all the people involved. So it's a major challenge, a little bit complicated, but this is a complex world, okay? And the last one, it's overlapping with the other two workshops, which is the how did you say, Tanya, centricity? Yeah, so the role of the patient. We think that the patient is still not in the center, as it's supposed to be, and that it's not really considered a stakeholder. So what are the solutions? You will see now that the solutions are lots of them. I hope that you can read them. So for the budget, we became very original. One of the things that became very, very clear is that we have to be more flexible with the budgets. So at some point, somebody proposed what is called a backpack budget for each individual. So saying that each individual have different needs, so they will use the budget for different things. How to do this? It's not very easy, but one of the solutions could be to have in all the departments, social affairs, health, transport, whatever, to have a cross-sectional box to tick for health. So it would be like cross-department share of the budget. And another part of this, another solution would be to do more research on where to actually put more money to get more value of it. So do more research on what strategies actually improve the life of people and to actually use them and measure the life of people at some point. Okay, the second challenge, this complex one about coordination and information, the first one was on to really implement the chronic care models. We had a speaker who said that we have to go beyond that, but our point was that maybe this chronic care model is not really implemented. We We don't have good stratification. We don't have good case manager identification. We don't have good coordinations. But even go beyond, like increasing the skills of the teams and including lawyers, work specialists, okay? Then the second was about sharing information. We understand that last year, the event at Brussels was about sharing information and the problems of data protection, but we think this is still an issue. We are never going to have good coordination without sharing the information across the levels, okay? That means healthcare and workplace. And of course, to have a clear roadmap to implement all the goals. So the goals are there. We have good and nice policies, but nobody is telling us how to implement them. So that's what we are asking for. We want a roadmap of how to implement them. And for the final challenge, the patient role, of course, we had a solution that is very similar to what the other workshop said, which is to increase the health literacy of the population. And here we went directly to citizenship. So we all need to have some health literacy. And the last one will be to make it compulsory, so to systematically have patient representation in decision-making bodies. Finally, in this point, and somebody said that this could be actually a EULAR task force, is to understand how to measure need-driven approaches. So how we know how to measure health, we know how to measure processes, how can we say that we actually did a need-driven approach? So those are the solutions. Thank you very much.
Thank you, Loretta. My friends in EULAR have been so efficient that we have a couple of minutes if there are any burning questions or comments from the floor. I ask with fear and trepidation, but there is one. Thank heavens for that, sir. Someone is awake after lunch. Marvellous.
I just got my coffee. Actually, my point, and this morning I had a revelation. My name is Ovidiu Constantinescu, I come from Romania, and all of a sudden here in Brussels I have a revelation. I think we shouldn't be, more flexible with the budget. We have to be more radical with the system. Let's take health money from the costs and moving towards investment. What we have here, we have the worst management in a company possible. There we have 33% of our working robots with some kind of misproduction. You have people with 20 years, 30 years of working life shelved in the back. Instead of spending money on keeping them in the back, let's spend money as an investment on keeping them working for 30 years. And I think that's the key to it. Let's move. And that would make accountants very happy, because we are talking in our workshop, how can we measure happiness of a RA patient? And we decided that work is not there. We were here talking more or less about money, how much it costs keeping people in work, how much money the state loses if it doesn't. So therefore, I think there is a need to change perspective. Let's spend money on health, making sure that people can have a return on that investment. And I think that would sort more or less everything. Because if we...
I love the idea of the universal solution. And your views are very well taken. I see a lot of nodding going on in the room, which suggests that the remarks are well taken. Thank you for that very much indeed. We'll take one other comment just behind you, I think. Please. That's actually yourself.
Oh,
yeah.
Well, I think I made a friend here, but I just want to...
we've got two friends next to each other. How wonderful.
We're going to be soulmates. But I just really want to support this point. It reminds me of the phrase of our esteemed Irish author George Bernard Shaw, and he says, the reasonable man adapts himself to the world, and the unreasonable man adapts the world to himself. And therefore, all progress is dependent on the unreasonable man. And I think what I heard in the conversation was that really what we wanted to better shout for RMDs within existing resources. And my question would be, why? We have an excellent business case around investment in prevention and the treatment and the management of this. If we can improve the scores of our individual targets, there is a definite economic return on investment, a phrase that was not used by any of our colleagues at the beginning. We talked a lot about investment, but very little about return. There's a real return on this investment here. It's a bankable commodity, and I think we have to start thinking in really not revelatory ways, but revolutionary ways.
Thank you.
And that would be my suggestion.
Thank you very much. I don't know if any of the workshop leaders wish to respond or comment.
Oh, yeah, actually, because of the money that came in our workshop, when we said flexibility, it was more flexibility in their minds to accept radical changes. So, yes, so I'm basically with what you're saying. And at some point, we could not say all the solutions in there, but one of the solutions was actually to focus not on dependence, but on how to avoid dependence, so how to actually stay in health. So actually, it's one of the solutions that we proposed, is to focus on how to stay in health. That is prevention. We have the business case in musculoskeletal diseases, so it's very, very easy. I think we can actually do it. We can become an example for others.
I very much like the idea of the RMDs to the fore across the field of medicine. I mentioned at the beginning of the day that I believe we've already done that with the advent of our new pathogenesis-driven therapeutics and really extraordinary changes in strategic approach. So let us continue to lead. Could I then ask you to join me in thanking both our rapporteurs, but also their partners who led the workshops just prior to lunchtime. Thank you very much indeed.